Good morning. It's a cold morning in Western New York. So we're doing a trial neurostimulator, and this is a procedure that is done for chronic pain, and it's a trial. So the trial lasts about 5 or 6 days. It's done under fluoroscopy. So what we're going to do is to map out where we're going to insert our leads, and we do that percutaneously or through the skin. So we have to map out where we're going first, and then we'll insert our stimulators. Mark out on the skin where our target is and the angle at which we're going to approach, and then we have this. So that's where we're going, right where that circle is. So now I have a 14 gauge spinal needle in the patient's back, and approaching the T12L1 interlaminar space, and we can see it here on the screen. The needle in the canal, and we're going to advance the electrode. All right, so now the electrode is in the spinal canal, epidural, outside the dura, more of those doctor words. And here we have the picture, and keep that camera rolling there. Give me real time. You can see the catheter moving, and you can actually steer it. Now we're at about T7, T8, that's the thoracic area. You can see it up on the screen. Now we'll take a lateral x-ray to make sure that we're also in the proper position from right to left. It's always nicer if you could have 2 leads instead of 1. These are Boston Scientific Infineon leads. They have 16 contacts per lead, and we want to get the optimal pain relief we can for this patient. So if you can get a second trial stimulator in, lead in, it always helps. So we've got our second in. Let's look at the screen. And you can see on the left screen, that's the AP, or front to back. You can see our top one, our top lead up there, and then the second lead is just coming in. And on the lateral view, over here on the right screen, we know that we're posterior to the cord. So now we have our leads placed. This is the AP, or front to back view, so they're parallel, they're not crossing over, they're up at the T7, T8 disc. So now we're going to show you the lateral posterior. This patient has some scoliosis, so there's a little parallax, but we're posterior in the canal. Now what happens is we're going to trial this, and so we're going to hook it up to our generator. Our Boston Scientific neuromodulation technologist is going to turn it on. So now this is in twilight sleep. So a patient's under intravenous or type of sedation, and they'll slowly wake her up so that the technologist can talk to the patient and find out where we're getting the best pain coverage. So these are hooked up to the Boston Scientific generator and into the computer, which runs the programs for the different pain control patterns. So these procedures can be a little, I'll use the word fussy. They have to be quite specific. It's not just you're sliding something up in the canal, you have to kind of drive it. And so I've had to, as the technologist was testing the patient was feeling symptoms in an area that we didn't want them to. So I had to reposition, back them out, and re-navigate. So here, now I think we're better positioned. Once again, this patient has a scoliosis. So we're immediately to the right and left of the midline, up in the thoracic area, and we're in the posterior portion where it's supposed to be. So it takes a few minutes sometimes adjusting and talking to the patient and covering their painful areas. In some areas you can. Sometimes all the areas are covered, sometimes none of the areas, and other times different parts of the areas of their concern. So these are our final pictures. So we're up at about the T8-9 area.